Europe now, epicenter of COVID-19 pandemic WHO. This transmission electron microscope image shows SARS-CoV-2, also known as 2019 nCoV, the virus that causes COVID-19, isolated from a patient in the U.S. Virus particles are shown emerging from the surface of cells cultured in the lab. The spikes on the outer edge of the virus particles give coronaviruses their name, crown-like. The World Health Organization said Friday that Europe was now the epicenter for the global coronavirus pandemic and warned it was impossible to know when the outbreak would peak. Europe has now become the epicenter of the pandemic, WHO Chief Tedros Adhanom Ghebreyesus said in a virtual press conference. He said the continent had now more reported cases and deaths than the rest of the world combined, apart from China. More cases are now being reported every day than were reported in China at the height of its epidemic, he said, referring to the global numbers. The virus, which first surfaced in China in December, has now killed more than 5,000 people, with cases around the world topping 134,000, according to an AFP tally. Tedros said the deaths passing the 5,000 mark was a tragic milestone. Maria Van Kerkhove, who heads the WHO's Emerging Diseases Unit, said it was not possible to predict how the pandemic will develop. It's impossible for us to say when this will peak globally. We hope that it is sooner rather than later. Their comments came as countries in Europe and around the world put in place dramatic measures to halt the spread of the virus, including closing schools and tightening borders. Tedros said such measures could help, but stressed that countries needed to take a comprehensive approach. Not testing alone, not contact tracing alone, not quarantine alone, not social distancing alone. Do it all, he said. He stressed the need to do more to detect, protect, and treat cases. You can't fight a virus if you don't know where it is, he said, calling on countries to find, isolate, test, and treat every case to break the chains of transmission. Every case we find and treat limits the expansion of the disease, he said. Do not just let this fire burn. Any country that looks at the experience of other countries with large epidemics and thinks that won't happen to you is making a deadly mistake. Michael Ryan, who heads the WHO's Emergencies Program, stressed that so-called social distancing measures, including banning public gatherings and school closures, are not a panacea. They are not going to stop this on their own, he said. As more COVID-19 cases appear in the United States and around the world, the need for fast, easy-to-use diagnostic tests is becoming ever more pressing. A startup company spun out from MIT is now working on a paper-based test that can deliver results in under half an hour, based on technology developed at MIT's Institute for Medical Engineering and Science, IMSS. Cambridge-based E25 Bio, which developed the test, is now preparing to submit it to the FDA for emergency use authorization, which would grant temporary approval for using the device on patient samples during public health emergencies. Elsewhere around MIT, several other research groups are working on projects that may help further scientists' understanding of how coronaviruses are transmitted and how infection may be prevented. Their work touches on fields ranging from diagnostics and vaccine development to more traditional disease prevention measures such as social distancing and hand washing.